Neurosphere Digital Care allows you to go beyond the status quo, to break boundaries and transform care for people with chronic pain and movement disorders, and provides powerful, intuitive tools that enhance therapy management. Starting with Abbott's latest advancement in patient-centric neuromodulation platforms, Neurosphere Virtual Clinic. Go beyond your clinic walls and extend patient care. Give patients the flexibility and comfort of receiving care anywhere. Perform routine programming adjustments and device checks remotely. Neurosphere Digital Care is here. For you, for your patients.
In the time of the pandemic, we have, of course, started also treating patients by telemedicine. Especially for DBS, this is very important because we know that when you program a DBS patient in the outpatient setting and you send the patient home, there's always need to check the stimulation parameters when he's at home. So we often hear that it was okay in the hospital, but it's not any longer when I'm at home. So I think the telemedicine approach is very useful. But as I'm aware of, there's not much literature on that. And the problem is that so far we could not directly program the stimulation parameters by our patients. We could only set programs for the patient, program a device, so that the patient can change predefined programs at home. And this is how we did it so far. So I'm very happy that there is a way to completely program a patient with a telemedical approach in the future. For patient selection, we of course look for the younger PD patients who are capable of using this technique. But of course we also ask patients who are not really happy with their settings or the outcome of deep brain stimulation. And I think fine-tuning when the patient is at home is very important. Some of the appointments that we have today in the clinic could be shifted to an online appointment, especially when the patient feels very well with the DBS setting he or she has at the moment. So for these patients, it is very good to make maybe just a very fine change. My view of Abbott has changed by the introduction of Neurosphere because I'm very happy that we have something we can offer to the patients. When a patient is coming to me and asks if DBS can be performed, then we have a very strict process for the patient selection. But at the end, if the indication is positive, we of course offer all potential devices. And we like, of course, here in Cologne, the directional programming with multiple source current, and therefore we use such devices. And we have started the sensing approach where we can measure chronically LFP activity in the patients. And I'm very happy that we now can offer the patients before the surgery one device that is capable of telemedical programming. We have a clear practice how we treat our PD patients post-operatively. We will see them 3, 6, 12, 24 months afterwards. And when there's a problem, of course, even more frequently. What I suggest is that one could integrate the telemedicine, especially for the patients where the patient or the doctor is not completely satisfied with the outcome. However, I would suggest that the patient is coming to the hospital first for a monopolar review, where we look at the effect of deep brain stimulation on all contacts, which we usually do here in Cologne at 3 months post-surgery. And then we try a new setting afterwards. After 3 months, usually the microlesional effect after surgery has disappeared. And therefore, 3 months, in our view, is a good time to start this monopolar review. And of course, we could implement a phone call interview and ask, for example, if the patient is satisfied. If not, we could offer telemedicine in the future to fine-tune even further, because we can then use the monopolar review that was done on ward to further program the patient at home.
Neurosphere Digital Care is here. For you, for your patients.